today for this class. Today we're going to be talking about culture, and we're talking about cultural diversity in a nursing facility like this one. According to the American Academy of Medicine College, AAMC, all healthcare professionals should receive training in cross-cultural communication, also called competence, as one potential for strategy for addressing racial or ethnic disparity in healthcare. As we know, America is a melting ground. All people from different cultures are coming into America, and they come here, they get sick, and we have to take care of them. So as a nurse, we are taking care, not just when they're sick, we're taking care as we embody the whole culture and everything. We call it holistic care in nursing. So what that means is using holistic modalities that recognize the importance of cultural competence. Healthcare providers are required to have at least one knowledge about the culture, including common beliefs and practices of all diverse patients. So we as nurses, as caregivers, we have to have knowledge of all other cultures. So here today, I'm not going to talk about the other cultures. You know, we have too many of them in America. I am going to concentrate on the Muslim woman. Cultural appropriate care is care that takes into consideration the requirements of the cultural group set. When treating Muslim woman, this means considering her religious preferences. It is necessary to understand that her cultural perspective necessary to understand her cultural perspective in order to provide cultural competence. Cultural sensitivity just means a respect for the culture of others, and which is extremely important. Culturally, the United States of America is considered a melting pot. People from all over the world travel to the U.S. for receiving treatment. Besides, many from around the world aspire to migrate to America and settle. It is therefore important that the caregiver should have a proper appreciation of cultural perspective for the care of people. Healthcare choices and Islam. You know, the Muslim people practice Islam, and they believe so much in their Quran. Whatever is in the Quran is what they want to do. So in order for us to get that collaboration, for them to participate, we have to accommodate their culture in our practice. So they have these diverse practices, which includes specific practices related to contraceptive and birth, sanitary practices, marriage, courtship, divorce, diet practices, religious rituals, prayers, hospitalization, medical care, consent, clothing, dying, and then all this is included in the Quran, and then they're going to do it the way it is in the Quran. So we are just going to have a way to accommodate them in our practice. Hospitalization, medical care concerns when they're in our facility. Gender issue. When possible, female healthcare providers should care for Muslim women. They don't want a man to come and care for a woman, or a woman caring for a man. So especially for sensitive areas like, the genital, when you're doing care, they're not going to cooperate. And we want that cooperation in order for us to have a better outcome. So if we have a Muslim that's a female in our unit, we need to find a female to take care of them. If it's a male, we need to find a male to take care of them. And prayers. Muslims are required to pray 5 times a day. Those who are not physically or medically restricted to bed should be provided a space to pray in a secluded, clean, and quiet place. A hospital chapel may be used provided there are no religious icons. They don't believe, they don't believe in other religions, so they're so specific in their own religion. So we make sure we give them that opportunity for them to pray when we care for them. If the patient can fast safely and take nourishment and medication during other hours, it may promote recovery because of the great comfort gained from this tradition. If we know during Ramadan is coming soon, they're going to be fasting from 6 a.m. to 6 p.m. We can do their AM care or give their medication about 5:30, and then we can have the doctor to order the medication before the time, and then like after 6 p.m. they can still get their medication. Eye contact. Muslims of many cultures will avoid direct eye contact during conversation as a sign of respect for the speaker. This is especially the case with Muslim women, whose cultural norm of modesty discourage direct eye contact with unfamiliar males. So do not take offense or feel that they are not paying attention. They don't like to make eye contact. It's not disrespect for them. Even in my own culture, when I look at my mother in her eye when she's talking to me, like, you don't have no respect. You're disrespecting her. But it's different over here, because here if you're not making eye contact, they feel like you're not paying attention. And touch, we have to be very sensitive. They're sensitive to touch, especially when it concerns opposite sex. They don't want to be hugged and touched like we do all the time. The diet. During Ramadan especially, healthy Muslims from all age puberty are required to fast. This means abstaining from consuming liquids and food during daytime. Hospitals should make provision for them to eat at the appropriate time. We can save them breakfast at 5:30 and save them their dinner at after 6 o'clock, because we know during that time they're not going to eat. They have some foods that they don't like to eat. Pork and any other pork product is not for a Muslim. They don't eat it, and we need to make our dietitian know that, so we can incorporate them in our diet. Other than that, they're not going to eat, and they're not going to eat, they're not going to cooperate, and then it may care difficult for the nurse. So we have to make provision for them to have what they're supposed to eat. They can eat meat and derivatives that have been killed ritually, and they don't eat meat that's just killed any kind of way. They eat meat that has been killed in a ritual in their own style. Muslims will resist taking medication that are narcotics and contain forbidden substances like alcohol and pork. We have some kind of medication that are made from pig, so they're not going to receive that kind of medication. Clothing. Modesty is very important for a Muslim woman. They know that to be seen in the public, they have to cover their skin and hands and arms. A Muslim woman may need to cover her body completely and should always be given time and opportunity to do so before anyone enters into the room. We'll make sure they don't want us to come see them when they're not dressed up. So we have to provide a privacy for them. Women may also request that a family member be present during an exam and may desire to keep on her clothes during an exam if at all possible. The healthcare provider should wrap Muslim women with consideration for modesty during examination. We just have to expose the area that we're working on. We don't need to, take off their clothes. Even if we give them the hospital gown, it should be a long one, or we let them wear the long gowns and wear the hospital gown on top, so they can feel comfortable, going outside the room. This means a care provider should ask a Muslim woman permission prior to uncovering her body parts during sensitive exam. Respect their modesty and privacy. Some examinations can be done over a gown. You don't have to take out the gown to, feel their heart pain. You can, if they're wearing light clothes, you can do that on top of your clothes. Hygiene. Islam places great emphasis on hygiene in both physical and spiritual terms. Muslims will maintain a level of ritual cleanliness before prayers. Before they go up to pray, they get and wash themselves, wash their private. They have to do that every time before they pray. So we have to provide them that opportunity to do so. They like to use running water. If it's not running from something, they feel it's not clean. So we can provide them with something that they can put their water in when they're in our hospital, and give them that privacy. Washing with water after urination, they do that. After defecation, they make sure they use water. The removal of armpit and pubic hair is something that they do. keeping their nostrils clean, keeping fingernails trim and clean. Toilets should be equipped with a small water container to assist with washing. A beaker of water should be made available to a bed-bound Muslim patient whenever they are in bed or after they use the bedpan. The language, most of them will not understand English because they're coming from different regions of the world. Language is a serious barrier in healthcare provision and healthcare utilization. If a patient is assessed to have inadequate English, healthcare providers must engage a professional interpreter. Medical interpreters should be proficient in both languages, understand medical terminology, and importantly, understand general cultural issues like family structure and roles. An interpreter of the same gender is preferred, especially in discussing sensitive and intimate topics such as sexual relationships. Take time to explain test why you are doing it, what they need to do, procedures and treatment. Many Muslims are new immigrants and may have a language barrier. Because if you don't understand what I'm saying, it's not going to make any, you're not going to make any use or make any difference. It's not going to make them be able to participate in their own care. So they need to understand why we're doing certain things or why we do it the way we're doing it. Death and dying. When a Muslim individual is dying, several things may be comforting to the patient and the family, like turning the patient on the side to the side of Mecca. It depends where they are. I don't know which way it can be south, it can be east, but they want to turn their face facing Mecca. It's important to the religion. The body must be kept covered at all times. It is best if only healthcare professionals of the same gender touch the body. Verses from the Quran may be recited by a family member or a friend. Prayers may be offered. Allow the family and imam. Sometimes we can request the services of imam to come and do the rituals after somebody dies. And they don't keep their bodies for long. Within 24 hours they have to bury them. So we have to make the provisions for them to respect their religion. And even the dead body, the female body should be given the same respect and privacy as she was living. They still don't want you to touch the body. They still want the female to do a female, even
Attention all vets. Bingo will begin in the rec hall at 2
p.m. This is just a 5 to 10 minutes
Bingo
video.
rec hall at 2 p.m.
If you have any questions, you can ask me. Or if not, thank you all for coming. Thank you.